So for those of you joining us for the first time, Breathometer provides the world's most accurate environmental insights across 94 countries down to a 5-meter resolution. My name is Tamir Kessel and I lead Breathometer's healthcare business. Today's event is a special one as I have with me Eric Kloss, the inventor of Daily Breath, which is a mobile app for those with asthma that pinpoints triggers one symptom at a time. Eric's been a health IT professional for over 30 years and has a couple of startups under his belt. He's spent the last 5 years accumulating over 10,000 hours in the domain of environmental factors and respiratory health. Eric, welcome. Thanks for joining.
Hi, Tamir. Thank you for having me today.
Eric has joined us today to share the story of Daily Breath, including his personal journey to finding better, more personalized health solutions for chronic respiratory disease sufferers. I'm sure this resonates with those of you on the path or working towards a similar goal. Eric, perhaps you can start with your origin story and what motivates you to help those with respiratory conditions.
Sure, Tamir. Well, you asked how this started. There was a light bulb moment about 4 to 5 years ago. My sister was living with the family at the time, and she has rheumatoid arthritis. And so one morning she came down with kind of her gnarled fingers, indicating that she had was having a flare-up of her rheumatoid arthritis. And she casually kind of said, you know, Eric, you ought to develop a mobile app that would tell me when my RA is going to flare up based on weather changes and things like barometric pressure, humidity, precipitation. And so it was kind of a light bulb moment for me. I just kind of thought about environmental factors as a determinant of health. I felt like the medical community really didn't talk about it that much, or it wasn't something that was really highlighted. And so I began a journey at that time to kind of do my own research around the topic and start learning about it. And I ultimately decided to focus on respiratory conditions because, you know, obviously pollution and pollen and weather are, you know, the impacts of that on a respiratory population are pretty apparent, right? And then also I realized that the disease burden is pretty significant for patients, for family caregivers, and on the healthcare system as a whole. But ultimately, I did not have necessarily a family member who had asthma. But what really moved the needle for me from a passion perspective was an article I read that said that doctors were trying to pinpoint the cause of an asthma attack after a 15-year-old girl had had a traumatic event. And the nonchalance of the title of the article really kind of struck me, because when you read the detail, this young person was actually basically was down for 20 minutes, obviously stopped breathing, and she's now traumatically impacted. She's a paraplegic for life. And so it just kind of struck me as, determining triggers after the fact is really not what we're really trying to do. We should be trying to pinpoint triggers ahead of time and really preventing asthma attacks. So that really is the source of my passion, and it's why I'm driven to kind of ensure that one life breathes easier.
Yeah. Thanks for that. Makes a lot of sense. I really understand why you're so passionate and so focused in this bit. Do you think the general asthmatic population understands that environment, how the environment impacts their symptoms? Why are they, and why are they not more trigger management systems in place?
Right. Well, I think there's a loose understanding, but I think to your point, I mean, people have a general sense that they're kind of at the mercy of the weather and the environment. It's not like you can change the weather, but the reality is you can be health prepared, right? And that is really the goal of changing the focus of how we're approaching asthma attacks, right? Instead of really looking at asthma attacks as kind of a default. If you have asthma, you're going to have asthma attacks, right? Well, we want to kind of change that paradigm. We want to focus on trigger management, trigger education, awareness, reduction, and avoidance, as opposed to just, assuming that if I go outside, I may experience some type of exposure that will cause an asthma attack.
That makes sense. And then in that context, tell me about Daily Breath. What is it, and how is that unique in solving this problem?
Right. Well, so I came up with kind of an idea that I felt the weather, the pollution, and the pollen actually converge. And usually you look and you see an air quality index, or you see a pollen count, or you see some weather variables, but it's actually how all of these things converge to create kind of your exposure index, right? So, when you go outside, you're individually susceptible to this confluence of factors. It's not just one particular thing that triggers an asthma attack, but it's the entire environment that surrounds you that actually causes you to have an asthma attack. So I felt you could develop a personalized risk index over time by tracking symptoms. So, in the mobile app, you actually are able to track symptoms, and that ultimately drives a personalized symptom forecast for you. And then there's some unique characteristics where you're actually able to track the place where you're having these experiences. So again, that gives another filter for risk. Where in my community am I experiencing kind of that confluence of pollution, pollen, and the weather that's causing me to have difficulty?
And what have been the obstacles and frustrations that you faced along the way when attempting to develop a better solution? And what have you learned since deciding to head down this
Sure.
road?
Well, I think my experience probably wasn't much different than Breezometer's founder, right? You're looking for air quality and pollen information, and my impression had been that it was fairly granular. It was very localized, hyper local, and that it was real time, that it was very timely. And unfortunately, when I looked at that, I looked at air quality measurement and pollen measurement and learned that it wasn't very granular. That, for me in Fairfax, Virginia, the closest air quality station or measurement station is over 30 miles away, right? And so it wasn't very granular. And so that's somewhat problematic. And then with pollen measurement, you have a very antiquated way of measuring pollen, right? It's a piece of fly paper that captures pollen spores on it. And someone literally brings down that paper, looks under a microscope, and determines the pollen count and what the pollen type is. So I really felt that was the biggest gap. And so for me, when Breezometer emerged as kind of the global air quality leader, they were taking inputs from satellite data and vegetation data and really getting down to a hyperlocal, 5-meter level. So you can actually deliver personalized symptoms forecasts because you're tracking specifically what they're experiencing, what symptoms they're experiencing with that particular granular data available.
Yeah, and I guess having information from just station data is very useful for doing aggregated type of research. But if you're an asthmatic, knowing that pollution is high, 3 miles down the road is important, but it may or may not be relevant to you. So that hyperlocality is absolutely critical to really understand how it's going to impact you personally and your condition, right? So, in the market, I speak to all sorts of new digital therapeutic solutions for respiratory diseases. Why do you think that is happening now? Why are there so many? What's changing in the market? Is it around awareness? Is it around the technology that's become? Is it to do with COVID? What's happening now?
Sure. Well, let me take that a couple different ways, and I'll talk about COVID last. But I think the first thing is that, I think you actually see that we have a very changing climate, and you see an increased number of extreme weather events, whether it's hurricanes, whether it's extreme heat, whether it's wildfire smoke. You have a map behind you of kind of California with, the wildfire smoke. And so I think that's kind of heightened the awareness of what are these impacts on a vulnerable population like people with respiratory conditions. And then you hit the COVID thing, and that is, one additional layer that's really accelerated the interest, right? Because people who have asthma and COPD already have vulnerable airways, right? And so they're potentially vulnerable to getting COVID more. We're also seeing some reports early on that are saying, areas with higher levels of air pollution have higher incidence of COVID. So you're seeing some type of correlation. I don't think that's totally known right now, so we have some gaps right there. But clearly, the other element is that people who have allergic asthma, they're having allergy symptoms, and they're they're confused. Is these allergies or are these early onset symptoms of COVID, right? So there's some confusion there. And so that creates a need or a desire to have tools that can tell me, okay, am I experiencing allergies, right? The tool itself will actually say, okay, well, there's an exposure nearby, so maybe it really is just allergies. It's not necessarily COVID, right? So I think that's what's kind of accelerating this. And then from a healthcare perspective, I think what's clear here is that there's been a great movement in self-care management, right? Without an ability to visit your doctor in person, people are looking for digital health solutions that can help them manage their own care between either those televisits or, you know, in lieu of going to visit the doctor, what can I do just to keep my condition in check?
Yeah, yeah. I think it's everyone's talking about how COVID is changing the world and accelerating some trends, and this is definitely one of them. You know, they think about telehealth as being just the ability to talk to your doctor remotely, but it's also about being able having at your fingertips the ability to take care of yourself and have more personalized information, right? That's what tracking your own symptoms, your own condition, and the environment around you is what's enabling this. So, but how do we encourage that self-care? You know, how do digital therapeutics use the data to help people manage and improve their conditions better? You know, practically, how do they do that?
Right. Well. So I think one of the keys here is that digital health solutions can offer kind of a feedback loop, right? And so what's unique about Daily Breath is we want to track your symptoms, your earliest onset symptoms, the warning signals that are associated potentially with your exposures outside, right? And once we start tracking those, then we're developing kind of a profile for what is your individual susceptibility to specific conditions that you may experience. So next time we can forecast if you're going to go out, what you might experience, right? And so I think that it's that feedback loop that becomes really, really powerful because people want to receive personalized insights. The way we've treated exposures to date has been based on what I call kind of a distributed public health broadcast model, right? You see an air quality index for a particular zip code, and what that's defining is that everybody within that zip code is impacted by the air quality exposures the same way. And what we're trying to do is flip that and say, listen, we each experience the exposures differently, right? Our exposure footprint is just like our genetic footprint, very, very unique. And so can we begin to capture that information and then use that information for the patient? I envision them actually using that information to, you know, reduce and avoid their triggers, but also we actually can begin to develop information about what's the drug interaction with those particular exposures. You know, are particular allergy medicines or particular asthma medications more effective or less effective, or can they be more targeted with precision medicine in the future? All of these things I think are possible when you have an information loop that defines symptoms and, you know, the exposures.
Yeah. So it's not just about personalized environmental data. What is the exact level of pollution or pollen or specific pollutant that you're being exposed to, but it's how your body, how you react to each one of those pollutants. So there might be a high level of, I don't know, oak pollen or carbon monoxide, and you might be an asthmatic that's reacted in one way, and I might be reacting to it in another. And it's about understanding that relationship between each individual and the exact pollution, environmental factors that they're touching on. It's also interesting. Sorry. Go ahead.
Yeah, well, and exactly. And I think the one thing that's been the gap is the way we've approached pollen previously is to focus on trees, weeds, and grasses, okay? And that's usually by seasonal observations. When do I experience allergies? Oh, trees in the spring, grasses in the summer, weeds in the fall. And yet, you know, we're actually vulnerable to specific types of trees. So as you indicated, some people might be vulnerable to oak trees. Well, we don't even have that, you know, predominant pollen type, you know, in most of the applications that are out there. And so, if you want to really deliver kind of personalized information, we need to know exactly what they're being impacted. The second thing is that you identified, we don't even know what the interaction between CO2 is in pollen. What is the impact of carbon dioxide on intensity of pollen, or the allergenicity, which is kind of, the impact it has on that individual, right? It could be definitely impacting you differently on any given day based on some weather changes or some weather impacts and those kinds of things.
Yeah, I think that interaction, that the more local we can get information, we can also better understand the interaction between the different elements of the environment. With climate change, there's a lot happening in that sense. Pollen seasons getting longer, etc. So the market's fast forwarding ahead. It's moving from preventative to predictive. It's being accelerated by COVID and telemedicine. But putting aside all these fancy words of AI, big data, and all that stuff, can you paint a vision of what digital health will look like in the respiratory space in, say, 5 years' time? What will the patient journey look like? Where do you think it can be?
Well, I think the areas of opportunity are really in what I call wearable sensors, right? So we're beginning to see some things that are emerging where they're starting to capture PM 2.5 and ozone, like literally on a keychain, right? And that's really giving the ultimate personalized profile for exposures, right? Right in your immediate environment, what are you experiencing? Not a mile down the road, not 5 miles down the road, but right around your person. So I think wearables are an interesting area of opportunity. The second thing is we're going through a transformation where, as I said, this information has been pushed by zip code. And now what we're going to do is say, well, the individual needs to pull the information to them. So how can I pull information that's personal to me and receive information? And so this is where alerts become very dynamic, whether it's alerts in the app or whether it's text messaging. Can you be notified, for example, at the aggregate level where the daily breath risk index is above 3 and you get alerted? Or if there's a specific variable that you determine is a prevailing factor for you experiencing asthma attacks, then you get alerted when that threshold is met. Maybe it's on days when it's 90 degrees or above that you seem to have more difficulty. So you could get an alert on that particular day. So I think that pull model is really emerging. And then finally, what's very unique about Daily Breath is what I call the community-based flare-up map. And that's crowdsourcing flare-ups or symptoms. And what that allows from a health perspective is individuals within a community to understand where the levels of highest risk are for a similar population, asthma sufferers, right? But beyond that, it actually, from a community perspective, shows stakeholders where pollution is worse, right? Is something that the community might be able to address, and address things like environmental remediation or specific mitigation activities, right, in order to support a healthier population within that community. So I think those are some really creative ideas and of how things will change over the next 5 to 10 years.
Wow, that's amazing. It's looking ahead, not just at the hyperlocal personalized environmental information and your personalized risk factors, but how, by accumulating that data over time from a community perspective, we can sort of feed back more information about the environment based on what we know from individuals. And then that sort of circular kind of feedback allows us to be even more personalized and more accurate. That's an amazing vision, looking at it from a community to the individual. Thanks for that.
Sure.
I think we're coming towards to that part of the chat where we'd like to open it up to the audience. So, and if anyone has any questions, please type them in the Q&A. This is the best time to do that. We'll see how many we can get through, and if we don't get to your question, we'll follow up with you directly. So, interesting question that's come up, and I think you touched on this, is, in your experiences, what is the relationship between pollen and pollution, and how does this affect how you account for a personalized tracker? You sort of touched on this a little bit. Maybe you can expand a bit more about what we know about the relationship between the two.
Sure. And again, I think this is a fundamental reason Daily Breath is somewhat unique is I felt that it's the convergence of weather, pollution, and pollen that impacts an individual. It's not those particular exposures in isolation. And so, to be frank, we don't know a lot of information because we haven't been measuring it, right? You can't manage what you don't measure, right? And so I do think that's where there's a lot of opportunity. And I do see, in academic areas, academic research, people exploring, what's the impact of CO2, increased levels of CO2 on a community or a particular type of pollen. I know of studies in Detroit around ragweed. I know of studies in Texas around mountain cedar, and they're looking at these types of dynamics. So I think what's interesting from a standpoint of the mobile health app or the digital health solution is that, now we start to aggregate more volumes of data. We know more information about, what is the experience of asthma sufferers in relation to these different types of pollution and pollen variables. And this information can really support, the research community in kind of beginning to understand what are these specific correlations. Because I just think, again, we don't have enough data. And that's really where this is an exciting time because, you use the code words of AI and big data, but the reality is that's what's enabling all of this, right? It's the ability to aggregate all of this data. It's the ability to apply machine learning to the data and really come up with more information that's helpful both for the patients and the provision of care to those patients, but also for the community at large.
Yeah, and what I see is it's really helping to accelerate the awareness around this, because even when I speak to some of the healthcare life sciences companies in the allergy space, they're very interested in pollen data, but they don't often look at pollution, right? They think, okay, pollen is what affects. Obviously, if you have asthma, I think that's well documented, well known, and asthmatics, COPD sufferers know that both pollen and pollution is going to affect them. But I think people with seasonal allergies are less aware of that interplay and the fact that, that there's already proof that carbon monoxide directly affects, intensifies, as you said, or triggers more pollen. So being aware of pollution levels as somebody who suffers from allergies is something really, really critical, because it's going to, again, help better inform you on your exposure, help you better plan for your daily life and being able to avoid that. I think the other place is, what would you say, is the best route to, in terms of awareness, to growing awareness, and what is the best route for businesses like yourselves to help patients and the general public grow their awareness, reduce their exposure?
Well, I think we're going to see that as these types of incidences occur. So, like, I'll give you an example. We have the wildfire smoke out in California. And, one of the things on my roadmap is kind of the capacity to build kind of a wildfire smoke alert. And so what that means is, based on dynamic winds and the plumes that are coming from the smoke that's being, travels literally 300, 500 miles in a particular direction, is there a way we can dynamically alert people to, okay, that particular smoke may be another exposure that you might experience today. So, I think you're seeing, extreme weather events, the changing climate, have things that people are looking at and going, well, wait a second. Yeah, these exposures are impacting us. They're impacting us more dramatically. We haven't focused on it from a health perspective, and yet those risks are becoming more acute. So, we need to address it from a health perspective, empower the patient to understand these impacts more. And if we can do that in a changing climate, we'll hopefully prevent potentially preventable asthma attacks. And that's one of the keys here is, unfortunately, I think the health system has accommodated asthma attacks. They think it's a norm for patients, right? But if you talk to asthma patients and family caregivers, they don't want to experience asthma attacks. They don't want to use their rescue inhaler. They want to avoid asthma attacks. They want to avoid the symptoms. And so that's what we're really trying to do, is empower patients.
Yeah. Yeah, I agree 100%. And I think it actually touches on, we'll take one last question here that's come up. And Mark, who's asking, asthma and COPD are chronic diseases that require managing over time, and patients' compliance to meds is typically poor, which also leads to exacerbations and deterioration. But are you aware of more forward-looking trigger data sources in weather, pollen, air quality? I have an answer to that. Maybe you can respond.
Yeah. Well, I mean, I think there's a lot of things that are emerging out there. Most people know about Propeller Health. Obviously, it's something that attaches to inhaler medication and tracks when people use their inhalers, the time and the location and some of those issues, and potentially may even connect to the weather and environmental conditions. The challenge with that is if we're only stamping the time at which they actually have respiratory difficulty that requires the use of relief inhaler, the question is, are there other symptoms that the person might have been experiencing, other exposures that the person might have been experiencing even hours before, that ultimately are leading to that that final flare-up, that final asthma symptom that tips over to the point of feeling some level of respiratory difficulty that requires this relief or rescue inhaler. So I think those are things that are emerging, and I think they're very positive in some sense, and they give a good profile. But is there a way to actually capture maybe early warning signals of asthma symptoms?
Yeah, and I think this touches on what you were saying earlier, looking into the future and wearables. So, I mean, if you can take biological signals, be it from oxygen levels, say for COPD, and combine those with forecasts for air quality and pollen, then here's somebody whose condition is deteriorating. He doesn't even know. He or she doesn't even know. And we can warn them, hey, your condition is currently very susceptible, and the environment's not quite healthy in the near future, because we know the forecast for the next few hours is not great. Protect yourself, be aware, and then help to. And I think it's that really intelligent combination of all of those factors, which, as you said, some companies are already using that to build sort of prediction algorithms. I think those are only going to get richer and more sophisticated. So I think that's a really, really good question to sum up on. I see there's a few other questions. We'll try to respond to those directly. I just want to thank everyone for joining, and I think. And thank you for sending the questions. I want to give a really big thanks to Eric Kloss. Thanks for your time. Thanks for joining us and for sharing your personal experiences in this journey. We look forward to seeing you all in the next live event.
Thank you.